Now let's take a look at some other endocrine glands. The pineal gland is attached to the roof of the third ventricle beneath the posterior end of the corpus callosum, right between the superior and inferior colliculi. After age 7, it undergoes involution, that is shrinkage. So it decreases in size about 75% by the end of puberty. It becomes a tiny shrunken mass in adults. We're really not perfectly sure about its true function, but it's clear that it could synchronize physiological function with the 24-hour circadian rhythms of daylight and darkness. It certainly synthesizes melatonin for secretion during the night. Melatonin fluctuates seasonally with changes in the day length, and it's said to be what determines our sleep patterns. Melatonin being synthesized during the night phase can be used as a supplement to reset our biological clock if we travel into different time zones. It also could be involved in regulating the time of puberty in humans, and certainly has an impact on a disorder called seasonal affective disorder. This occurs in the winter in northern climates. The symptoms are depression, sleepiness, irritability, and craving of carbohydrates. Many of us will have some of these symptoms as we have less daylight hours, simply because of shifting melatonin secretions with the shifts in the day length. People that experience long, dark days are most likely to have seasonal affective disorder. Personally, stemming from England, seasonal affective disorder is something that has affected me. However, in Colorado, not such a big deal. We just don't get that much darkness. Even 2 to 3 hours of exposure to bright, full-spectrum light each day can reduce melatonin levels and the symptoms of seasonal affective disorder. They call this phototherapy. The thymus is another endocrine gland. It plays a role in 3 different systems: the endocrine, the lymphatic, and the immune system. We'll spend a lot of time examining the thymus next semester when we consider the immune functions. It's a bilobed gland in the mediastinum, superior to the heart. It goes through involution also after puberty. And that makes sense because during our childhood is when we're most likely to be producing the most immune cells as we gain our immunities to various pathogens. The thymus is the site of maturation of T cells, which are important in immune defense. It also secretes thymopoietin, thymosin, and thymulin. These stimulate and development of other lymphatic organs and the activity of the T lymphocytes. We'll explore it in much more detail next semester. The thyroid gland itself is the largest endocrine gland. It's composed of 2 lobes and an isthmus. It's reddish brown in color and has a rich blood supply. The thyroid is composed of many sacs called thyroid follicles. You can see them in the image here below. They contain a protein-rich colloid. The follicular cells line the edges of these thyroid follicles. They're simple cuboidal epithelium, and they secrete thyroxine. Thyroxine is called T4 because it has 4 iodine atoms, and triiodothyronine is T3, which is basically T4 that's been converted by removing one of the iodines. Thyroxine and triiodothyronine, or T4 and T3, both act to increase metabolic rate, which increases oxygen consumption, heat production, appetite, growth hormone secretion, alertness, and much quicker reflexes. People who are short on thyroid hormones tend to be more subdued and complacent, whereas people that have too much thyroid hormone tend to be fairly jittery. You'll notice also that between the follicles are a number of C cells or parafollicular cells. They're called C cells because they're clear, and they secrete calcitonin. We've already explored its role in rising blood calcium. It stimulates osteoblast activity and thus bone formation. Right on the thyroid are four tiny little glands that are partially embedded in it. These are called the parathyroid glands. They can be found as high as the hyoid bone and as low as the aortic arch. They secrete parathyroid hormone. We've already explored its role in increasing blood calcium levels. It promotes the synthesis of calcitriol and increases the absorption of calcium from our diet into our intestines. It decreases the urinary secretion of calcium and also increases bone resorption of calcium. The adrenal glands are small glands that sit right on top of each kidney. They are retroperitoneal, as in right behind the peritoneum, just like the kidney is. The adrenal cortex and medulla are formed by a merger of two fetal glands with different origins and functions, so they have very different functions themselves. Again, the cortex is an outer layer, and the medulla is this deep central layer. The adrenal medulla is about 10 to 20% of the gland and has a dual nature, acting as both an endocrine gland and, you'll remember, the sympathetic ganglion of the sympathetic nervous system, some of the branches, and right here in the medulla. They are innervated by sympathetic preganglionic fibers and consists of modified sympathetic postganglionic neurons that were called chromaffin cells. When stimulated, these chromaffin cells release catecholamines, like epinephrine and norepinephrine, as well as a trace of dopamine. They release these hormones directly into the bloodstream. The effect is longer lasting than norepinephrine or epinephrine have as neurotransmitters. They increase alertness and prepare the body for physical activity, just like the neurotransmitter. It mobilizes high energy fuels, lactate, fatty acids, and glucose. It stimulates glycogenolysis, or the breakdown of glycogen, and gluconeogenesis in order to produce more glucose and boost the glucose levels in the blood. Thus, it has a glucose-sparing effect because it inhibits insulin secretion, and the muscles can use fatty acids and save glucose for the brain. Norepinephrine is also involved in increasing blood pressure, heart rate, blood flow to the muscles, as well as pulmonary airflow and metabolic rate. It decreases digestion and urine production. So in short, just like the parasympathetic and sympathetic inputs, norepinephrine from the adrenal glands has sympathetic effects on the nervous system, fight or flight, but it has a longer lasting effect than the neural secretion of norepinephrine. The adrenal cortex surrounds the adrenal medulla and produces more than 25 different steroid hormones that are called corticosteroids or corticoids. They include things like corticosterone and cortisol. There are 5 major steroid hormones that are produced in 3 layers of this glandular tissue. We'll see this zona glomerulosa, zona fasciculata, and the zona reticularis. In the outer thin zona glomerulosa layer, the cells are arranged in rounded clusters and secrete mineralocorticoids. These are the hormones that regulate the body's electrolyte balance. The middle thick layer, called the zona fasciculata, the cells are arranged in fascicles and are separated by capillaries. These secrete the glucocorticoids, like cortisol. The zona reticularis is the narrow inner layer, and this is the layer that secretes sex steroids. Take a moment here to diagram out an adrenal gland. Include the cortex as well as the medulla. And note the secretions from each of the different regions of the cortex, as well as those that we see from the adrenal medulla. There are several different categories of corticosteroids, as you may have seen. There are the mineralocorticoids that we find in the zona glomerulosa. They regulate electrolyte balance. Aldosterone is one of them. It stimulates sodium retention and potassium excretion. Water is retained with sodium by osmosis, and so blood volume and blood pressure are maintained. We'll explore this in a lot more detail next semester. In the zona fasciculata, the glucocorticoids are involved in regulating metabolism of glucose and other fuels, especially cortisol. This stimulates fat and protein catabolism. Gluconeogenesis, which means making glucose from amino acids and fatty acids, and thus sparing blood glucose. And a release of fatty acids and glucose into the blood. It helps the body adapt to stress and repair tissues. It also has an anti-inflammatory effect, which can suppress the immune system with long-term use. You may have had things like dexamethasone injections or other steroid injections to take care of inflammation. The zona reticularis secretes androgens that sets an individual's libido throughout life and has a large role in prenatal male development. These androgens include DHEA, which other tissues will convert to testosterone, and DHT, the really active form, dihydrotestosterone. The zona reticularis also secretes estradiol. It's a very small quantity, but it's super important after menopause for sustaining adult bone mass. Fat converts androgens into estrogens also, so body fat content in females is exceptionally important. The medulla and the cortex of the adrenal gland are not functionally independent. In fact, they interact with each other constantly. The medulla would atrophy without stimulation of cortisol from the cortex. Some chromaffin cells of the medullary portion extend into the cortex and stimulate the cortex to secrete corticosteroids when stress has activated the sympathetic nervous system. So there's a big interaction between the medulla and the cortex, and we'll see this as we look into the stress response coming up soon. Another endocrine gland is the pancreas. This is an exocrine digestive gland, and endocrine cell clusters in the pancreatic islets are found in the retroperitoneal portion. The pancreas is inferior and posterior to the stomach. There are 1 to 2 million pancreatic islets, or islets of Langerhans, that produce hormones. The other 98% of the pancreas cells produce digestive enzymes. Here are the pancreatic islets. You can see that they're composed of alpha cells, beta cells, as well as delta cells. Again, the majority of the pancreas is about producing digestive enzymes, and we'll introduce that next semester. The beta cells secrete insulin during and after a meal when glucose and amino acid levels are rising. It stimulates cells to absorb these nutrients and store or metabolize them, thus lowering blood glucose levels. It also promotes the synthesis of glycogen, fat, and protein, as well as suppressing the use of already stored fuels because there's plenty in the blood. It's basically all about storage. The brain, liver, kidneys, and red blood cells absorb glucose without insulin, but all other tissues require insulin. So people with diabetes type 1 who cannot produce insulin must have insulin injected in order to maintain their blood glucose levels and not have them skyrocket. Glucagon is secreted by the alpha cells, and it basically acts in opposition to insulin. It's released between meals when blood glucose concentrations are falling. In the liver, it stimulates gluconeogenesis and glycogenolysis. Basically, anything to release glucose into the circulation and thus raise the blood glucose levels. In adipose tissue, it stimulates the breakdown of fat and the release of free fatty acids to fuel our metabolic cycles. Glucagon is also released in the event of rising amino acid levels in the blood. It promotes amino acid absorption and provides cells with the raw material for gluconeogenesis. Finally, the delta cells, or D cells, secrete somatostatin. This hormone partially suppresses the secretion of glucagon and insulin, and thus inhibits nutrient digestion and absorption, which prolongs absorption of all nutrients. Some other accessory hormones that we see from the pancreas are pancreatic polypeptide, secreted by PP cells or F cells. This inhibits the gallbladder contraction and secretion of pancreatic digestive enzymes. Gastrin is secreted by G cells and stimulates stomach acid secretion, as well as motility and emptying of the stomach. Hyperglycemic hormones are the hormones that will raise blood glucose concentration. So those are glucagon, growth hormone, epinephrine, norepinephrine, cortisol, and corticosterone. Hypoglycemic hormones are all of those that lower blood glucose. Insulin is the primary one. Take a moment here to diagram out all the hormone secretions of the pancreas and give some explanation of where each goes and what function it has. The last major organs we'll consider are the gonads, or the ovaries and testes. Both are endocrine and exocrine. The exocrine product are whole cells, eggs in the ovaries and sperm in the testes. So thus they're called cytogenic glands. The endocrine product are the gonadal hormones. The ovarian hormones are estradiol and progesterone, as well as inhibin. And the testicular hormones are testosterone, some other weak androgens, as well as estrogen and inhibin. Now, it seems strange that males would produce estrogen, but they do. Small amount, but still enough. The ovary consists of a follicle, which is an egg surrounded by granulosa cells, and a capsule called the theca. The thecal cells are the cells that synthesize androstenedione, and they're converted mainly into estradiol by the thecal and granulosa cells. After ovulation, the remains of the follicle become the corpus luteum, which then begins to secrete progesterone for the 12 days that follow ovulation. The follicle and the corpus luteum both secrete the hormone inhibin. We'll see the relationships of all of these hormones next semester when we look more closely at reproductive function. The functions of estradiol and progesterone are the development of female reproductive system and the female physique, including adolescent bone growth, regulation of the menstrual cycle, sustenance of pregnancy, and preparing the mammary glands for lactation. Inhibin is involving in suppressing FSH secretion from the anterior pituitary, so it has a role in negative feedback. In the testes, we see microscopic seminiferous tubules that produce sperm. Here's a tubule here. The tubule walls contain Sertoli cells or sustentacular cells. And then there are Leydig cells or interstitial cells that lie in clusters between the tubes. The testicular hormones are testosterone and some other steroids from the interstitial cells, or cells of Leydig, which are nestled in between the tubules. These hormones stimulate development of the male reproductive systems in the fetus and the adolescent, as well as the sex drive. In addition, they sustain sperm production throughout life. Inhibin from the sustentacular or Sertoli cells also limits FSH secretion from the anterior pituitary in order to regulate the production of sperm. So you can see these hormones have very similar roles in the male and the female, although they're acting on distinct organs. There are other organs that have endocrine functions that may not be as apparent. They include the skin, the liver, the kidneys, and the heart, the stomach and small intestines, our adipose tissue, our bone tissue, and the placenta. The skin is composed of some keratinocytes, which convert cholesterol-like steroid into cholecalciferol using ultraviolet radiation from the sun. The skin and exposure to ultraviolet radiation is ultimately important in our production of vitamin D, as you can see soon. The liver is involved in the production of at least 5 hormones, but it converts cholecalciferol into calcidiol. That process of production of vitamin D is completed by the kidneys, who convert the calcidiol into calcitriol, which is the active form of vitamin D that's necessary to increase calcium absorption by the intestine and inhibit its loss in the urine. The liver also secretes angiotensinogen, which is a prohormone. It's the precursor of angiotensin II. It's a regulator of blood pressure. We'll see its functions in much more detail next semester. The liver also secretes erythropoietin, which stimulates bone marrow to produce blood cells. Hepcidin promotes intestinal absorption of iron. And the liver is also the source of the IGF-1 that we investigated earlier, which controls the actions of growth hormone. In addition to finishing the production of vitamin D, the kidneys also secrete renin, which is involved in converting the angiotensin that's produced by the liver into angiotensin 1. Again, the third step of this is accomplished by the lungs, where angiotensin 2 is created. This hormone, angiotensin 2, constricts blood vessels and raises blood pressure. The kidneys also produce erythropoietin, the remaining portion, 85%, which stimulates the bone marrow to produce red blood cells. The heart is a muscle that secretes atrial natriuretic peptide and brain natriuretic peptide in response to increase in blood pressure. It decreases blood volume and blood pressure by increasing sodium and water output by the kidneys. It opposes the action of angiotensin 2 and lowers blood pressure. Now, all of this may seem fairly complex. However, we'll investigate it in much more detail next semester. So for now, just note that all of these different organs have a variety of endocrine functions. The stomach and small intestine secrete at least 10 enteric hormones by the enteroendocrine cells. They coordinate the digestive motility and glandular secretion. Cholecystokinin, gastrin, ghrelin, and peptide YY are examples. Adipose tissue secretes leptin, and leptin is involved in slowing appetite. Osseous tissue, or bone, secretes osteocalcin, which is secreted by the osteoblasts. It increases the number of pancreatic beta cells, and thus the pancreatic output of insulin and insulin sensitivity of other body tissues. It inhibits weight gain and the onset of type 2 diabetes mellitus. The placenta is obviously another endocrine organ. It secretes estrogen and progesterone during pregnancy, as well as some other hormones that are involved in regulation of pregnancy, stimulating development of the fetus, as well as the mammary glands that will nurture the fetus after birth. So again, that's a lot of information. Take some time to absorb this, and then we'll move on to our next section.